Lights, camera, action. Hey gang, Mark Sweeney here from Austin Dental Spa in beautiful, hot Austin, Texas. As you know, if you've tuned in before, we do this about every Wednesday around 5:30. Today is no different, except that it's the first Wisdom Wednesday in the new month of August. As you know, if you've tuned in before, we have a different theme every month, and the theme for this month is Action August. So we got our movie props, and you're going to see that every Wednesday this month as we start talking about actions you can take to make your life better. So today is a good start off because we're going to talk about charcoal toothpaste and is it good for your teeth or not. It was a big buzzword a couple of years ago. If you're wondering about my big fat lip, I was eating Mexican food at lunch and talking to one of my advertisers and bit my lip while I was having a particularly good conversation. So now it's all swelled up just over here on the right. But we're going to talk about the good, the bad, and the ugly do's and don'ts for your mouth. And some of it might surprise you. And then for sure, the health tip this week is going to surprise you. What in the world does horror movies have to do with making your life better? So we're actually going to get into that subject. But first of all, let's talk about charcoal toothpaste and a couple of other things that you really shouldn't do. One of them, I'm going to get to that one and I'll tell you I do it, and yet this came from the New York Times recently. They interviewed dentists from around the country. Obviously they didn't call me or I would have taken the toothpick one out. But we'll get to that in a minute. But let's talk about the charcoal toothpaste. It was a big deal about 4 or 5 years ago that these charcoal toothpaste. Charcoal was all over the news. It was supposedly cured Crohn's disease, fixed upset stomachs, made your skin more beautiful, all kinds of health benefits supposedly. Now what we do know is brushing regularly. Twice a day we try to get people flossing once a day, and visiting a dentist regularly is good for your teeth. But the charcoal people out there wanted you to believe that you could skip all that stuff and just brush with their charcoal toothpaste, and not only would your teeth be healthier, but they would get whiter. I haven't had one patient in 45 years come in and say that their teeth actually got whiter from using something black on their teeth. The one thing charcoal was, the dental schools that do the research on this kind of stuff, they found that every one of the charcoal toothpaste was very, very abrasive. Like a lot of the whitening toothpaste out there, you older people will remember McLean's toothpaste was one of the first whitening toothpastes that actually supposedly made your teeth whiter. The commercials even had the little bing, the little star show up when the person smiled after using McLean's. Well, that doesn't happen in real life, and it doesn't happen that charcoal can actually make your teeth whiter. In fact, what the dental schools found is that people scrubbing with the charcoal stuff actually were removing a couple of micron layer of enamel. Now the problem with that is enamel doesn't grow back. It's not one of those things like skin that if given enough time it will grow back. What you get at 6 years old when your permanent teeth start coming through, that's your enamel for your life. And there are a lot of stem cell studies going on. We've covered that in Wisdom Wednesday before, that scientists are trying to grow tooth structure back and even claiming that they're close to or on the verge of growing whole teeth from nothing. We've covered that before. It's out there on the internet. You can find that and do your own research on that, but there are dubious things to that research. Anyway, the charcoal products were not found to be effective at whitening teeth. And like I said, they potentially could damage your teeth. So don't buy into all that stuff. Try to stay away from the charcoal toothpaste. The next one, and I can buy this, stay away from energy drinks, soft drinks, of course, we've known about for a long time, and a new one, flavored coffee. They have found that a lot of the flavored coffees, and we have a Starbucks right across the street I go to every once in a while, and they almost kick me out because I just say, I want a tall glass of the darkest roast you can get. And they try to rub it in a little bit. Do you want to leave room for cream or sugar or something else? And I'm like, no, fill it all the way to the top. I want my coffee black. But all the people in front of me and behind me are ordering caramel frappuccino, such and suches with soy milk or oatmeal milk or whatever. So they get kind of complicated. The problem with the flavored coffees is the sugar content. Not only is coffee a bit acidic, but you throw high sugar content in, and just like sodas and the sports drinks, which also have a low pH and in most of them, high sugar content, and that combination is not good. We've gone through this on Wisdom Wednesdays before. The sports scientists say that drinking just regular old cold water, straight out of the tap or bottled water, does more to rehydrate you than any of the sports drinks that are out there. Number 3, this is the one I gotta say, I cringed when I saw this. They say habitual toothpicking can cause damage. Now, I have seen people really getting aggressive with a toothpick in a restaurant as they're leaving, especially steak restaurants where they're really poking. I use a toothpick pretty regularly. I have the little plastic ones that are triangular shaped on one end, and the other side they look like a little miniature Christmas tree, and those things are a godsend to me because as I've gotten older and my gum tissue has dropped, there are spaces between my teeth that used to be filled with gum tissue, and I'm a dentist. It's DNA kind of thing. Thanks, Mom and Dad. It does happen, and those toothpicks actually do a really good job, and they're flexible. You can't really cause any damage. But those wooden toothpicks, I've actually had patients come in over the years that jammed one in there and got a splinter, like a little thin piece of the toothpick, because they were chewing on it and digging it around, and you could cause some damage, but it would also be causing some pain while you're doing that damage. So you'd know if you were damaging your teeth and your gums. They potentially, again, could cause gum recession, but only if you were digging at the same area on a regular basis. I've seen people walking around, we're in Texas, I've seen people walking around chewing a toothpick after they clean the food out, and that's just their thing. So you could do a lot worse things. So, using dental floss and one of those interdental things is a good secondary thing, but people don't typically carry dental floss around with them. So number 4, and this one I can agree to as well, don't use your teeth as tools. I was married to a Kentucky woman for a while, and apparently that's just what they do in Kentucky. She never opened a bag of Fritos or potato chips without using her teeth to open it. And I'd catch her in the middle of it and say, you're going to be sorry someday. But I've seen people here that chewed on pens at work or opened things with their teeth. I've had a couple of fishermen that were biting into fishing line with their teeth, and they wore a little ridge in their teeth where they were using the same spot over and over again over a couple of years. They wore a little notch in there because that nylon fishing line is pretty stiff. So you can chip or break your teeth. So let's go to the other side, to the good side. We're done with the dark side of the force. There's no more bad things we're going to talk about. We're going to talk about the good things. So be gentle with your teeth. Use a soft bristled toothbrush and a non-abrasive toothpaste. And the softer bristles will actually do more effect than the hard bristles. When I got to dental school at 21 years old, I was using the Oral-B 60, which is about that big with the stiffest bristles. Oral-B doesn't even make stiff bristled brushes anymore. It's all soft bristled because they found that you do a more effective job. Electric toothbrushes, the ultrasonic ones, Sonic Air and Oral-B, actually do the most effective job at cleaning your teeth, and it stops people from scrubbing because the brush is got some movement to it, and that's doing the work for you. So people that used to scrub typically stop scrubbing their teeth when they go to an ultrasonic toothbrush, and they move it around their mouth more places, whereas people that are using a manual toothbrush tend to hit one area about 90% of the time, go around and come right back to that area. They're thinking about what they're going to do at work that day or something like that. There is some couple of websites out there that claim you should hold your toothbrush like a pen and scrub like that. Nobody does that. Everybody holds it with, grips it with their palm. But next, swish with water. Like we talked about earlier, you don't really need the mouthwashes out there. If you've got a problem with bad breath, it probably is something else going on back in the back of your throat. But rinsing with water can help neutralize the acidity that's being given off by the bacteria that live in your mouth and that eat the same food that you're eating that's stuck on the sides of your teeth. So you can rinse with water, and it helps raise the pH so that it's not down low in the acidic range. And third, we've hit this on Wisdom Wednesdays before, don't brush right after you eat. I know a lot of women who carry a toothbrush and toothpaste around in their purses, and as soon as they eat, they get up and go to the bathroom and brush their teeth. It's been scientifically proven that it's actually better to wait about 30 minutes first because the acidity level is at its highest point for the first 30 minutes right after you eat, where the food that is stuck between your teeth and around your gums gets attacked by those bacteria. The acidity level goes up, which means the pH goes down. And so if you're brushing, especially aggressively, while that pH level is high, you potentially could wear enamel away more readily than you would if you wait 30 minutes till it's gone through that spike in pH and is back more to a neutral area. Or rinse with water first and then brush your teeth. So those are just little tips, pros and cons of things you can do, down and dirty, things you can start tomorrow. Now, let's get to the health tip. This one was a little off the board, but horror movies. Now, I'm not a big fan of those. I saw one when I was a kid, Black Sunday, I think it was, when I was about 8 years old, and I didn't sleep for about 2 years. So those things don't really get me, the zombie movies and all that stuff. But while they're scary, there's actually scientific research that for some people, in the right circumstances, they can be good because they know psychologically it's a movie. And so the scary stuff, they know these are actors. It's not really happening, but it gives kind of the same feeling of being scared, but you're not really being scared. And so you can rationalize that, oh, it's just a movie. You know, they would never have gotten to Saw 5 if there had been Saw 1. They would have caught whoever, I don't even know the plot for that one, but some of my patients are big fans of that whole series, and they can't wait for the next one to come out because they know it's a movie. And so it's a safe way to get scared out of your wits and still know that, you know, you're getting the adrenaline flowing, you're getting the juices up, but you know that it's not real. Now, that isn't true for everyone out there. So you got to know yourself well enough to know if you're one of those people that likes watching horror movies, hey, it's not actually probably doing you more good than harm. So go for it, indulge yourself. If you don't like those and you lose some sleep after watching one of those, then you're in the same category as me. I see enough of that during the day in a dental office. I don't need to watch it on TV at night. So that's my health tip for the week. Do something next week that makes you feel good about the world and about yourself. That's it for this week. First episode of Wisdom Wednesday for August. I will see you next week for episode 2 of Wisdom Wednesday. Cut.